get started here. Today's training is violence against EMS personnel. We're very happy to have our good friend Randall Eimerman, who is the NASEMSO NEMSIS Liaison. He's going to be talking about providing guidance on the documentation practices to support improved awareness, reporting, and the prevention of violence against EMS personnel. And this is to help the participants understand the significance of data collection related to violent incidents and how those records contribute to safety initiatives across local, state, and national levels. Randall, are you ready? I'll go ahead and let you take the stage here.
All right, thank you very much, Chris. Like Chris has mentioned, today's training will be on the violence against EMS personnel data set. During today's training, there will be a lot of slides. There's 129 total slides, and really we'll be going through the what they consider to be the HAZDataSet, very detailed. Instead of being able to make any comments or suggestions during the training, I just felt it would be best that if you were looking at a data element that you didn't agree with, you felt that needed some work, you would be able to submit a help desk ticket by giving you the access to the help desk ticket early. While we're going through each element, you'd actually possibly be able to submit right there. That was just a quick method for everyone to get, and we will make sure that this is displayed at the very end of today's training as well. So for today's training, we're going to review the violence project. A lot of steps went into getting to today. The intended use by the national, state, and local EMS agencies. Where to access the HAZDataSet and companion guide. Understanding the HAZDataSet, and then a couple of violence incident scenarios just to sort of help out with understanding on how that document would work, both during an EMS response and, if the EMS personnel is also performing any non-patient care duties. So the first topic developed under the HAZDataSet is the violence against EMS personnel document, which is a new set of data elements intended to be completed when an EMS personnel experiences physical, mental, or emotional violence. Future topics covered under the HAZDataSet are anticipated to include topics such as needle sticks and struck by incidents along the roadside. This training today will discuss the newly developed data set, the HAZDataSet. The HAZDataSet is intended to cover various hazardous situations that EMS personnel may experience or encounter while on duty. HAZ just sort of represents the hazards that the EMS personnel may encounter. So for just a quick project overview, one of the items was to characterize the occurrence of violence against EMS clinicians or personnel by providing evidence on the prevalence, severity, and the impact of these events. Inform the need for EMS clinicians' violence prevention and mediation education, and to training and safety resources. So, examples on that would be like spit hoods or restraint devices. We also wanted to promote advocacy for the victims and influence legislation to support safe working conditions for the EMS industry. We also had a very large set of sort of guiding principles here. One of the top things was to limit the EMS clinician documentation burden. I think that they do a lot of data elements already, and we wanted to look for a method to make sure we could encourage this data collection. Pursue a data collection process that fulfills multiple report requirements, such as a law enforcement report, workers' compensation, or EMS incidents reports. We wanted to seek feedback from local EMS agencies and clinicians. Promote a process that encourages response, support, and actions from EMS supervisors. We needed to keep the EPCR and the violence reports separate. We needed to consider how violence reporting may need to align with state discoverability law. Allow for different levels of data collection. The NEMSIS violent data schema can be tailored to protect the PII or PHI and serves needs at the local and state levels. It was to keep in mind that the NEMSIS violent data collection can be made optional for EMS clinicians, agencies, and states. So two of our violence project objectives were to explore additional field values for E-Other-06 and to capture violence against EMS personnel. The other task was to develop kind of a draft data dictionary, which has not been finalized, for collecting the comprehensive violence against EMS personnel information. So to start this overall process, we really went out and we met with a bunch of different different experts in the area. They were already doing data collection. One of them was the EVIR, or the External Violence Incident Report. It's a purpose-built incident report to gather quantitative and qualitative data about violent incidents. That was really led by Dr. Donnelly, Dr. Moz, out of Canada, who were very helpful in getting a lot of these items completed. There's also the SAVER system, which is the stress and violence to fire-based EMS responders. It's led by Dr. Jennifer Taylor at the Drexel First Center, and it is developed in the collaboration with the IAFF. We also met with several NEMSIS software vendors. They provided guidance and concerns, discussed that tools are already being utilized to collect violence against EMS personnel. After those kind of initial 3 meetings, there was kind of this draft data dictionary that was put together, and the NEMSIS TAC had held 4 separate meetings. I know we only see 3 up there. The 4th meeting was to actually kind of cover some of the survey results from the assailant details. But all the members of this working group responded through a survey. They edited it. They made their comments. Maybe some of the data elements were fine, just the way they were. We also looked at the existing NEMSIS data elements to reduce the personal documentation burden, looking for any member or any data elements that could be reused into this violence report. Members of this work group included that EVIR team, Dr. Donnelly and Dr. Moz, the SAVER collection system lead with Dr. Jennifer Taylor, NEMSIS compliant software vendors, and then we have a whole bunch of initials, NAEMSP, IAFF, IAFC, the USFA, the CDC, NAEMT. And really the most important member of this group was EMS personnel who were currently working in this environment every day. After we did a bunch of different surveys and meetings, we kind of had this sort of finalized data set. We had some finalized new field values for EOTHERSO 6. And one of the next steps we did was a legal review. We really wanted to make sure that these new field values were reviewed to ensure there was no conflicts with any state rules or regulations. Certain words can mean different things depending on where you live at. There was also a NEMSIS work group. The advisory board was involved, different members. We presented on V3 implementation calls. We held special meetings to review the data elements and obtain even more feedback. And then one of our last stops was actually to our NASEMSO members, our state data managers. They really helped with kind of reaching into each one of these data elements to give suggestions. The state medical directors fully supported this initiative and were excited about it. And then our state EMS directors, they always have a great view on all the different items that we do. It was just a great learning opportunity to see that everyone was excited to move forward. So after all of this great collaboration that we did, we were able to finalize some new field values for EOTHER 06. So the first objective is now complete. New field values have been added into version 3.5.1 of NEMSIS, EOTHER 06, or the type of work-related injury, death, or suspected exposure. This is a state-level data element. This data element within the NEMSIS EPR has a specific use for the events that occur to the EMS personnel providing care. The hazardous data set also includes details on 86 data elements and is split into 10 different sections. Currently, the elements within the HAZDataSet adhere to the national standard, but stand alone as an optional set of new data elements that an EMS agency or state working with their software vendor can implement. The HAZDataSet will be maintained on a different life cycle than the NEMSIS data standard. We're going to be much more detailed into each one of these sections in a little bit further. The violence document does include data elements that can be mapped from an electronic patient care report, or EPCR, and new data elements for describing the violent incident and the follow-up actions taken. A violence report that incorporates the structured elements and narrative is intended to be maintained separately from the EPCR. And what we're trying to show here is if you were on an EMS response and you actually completed all of the data elements for that EMS response and you experienced a violent incident, you could actually map over a bunch of the data elements that we've tried to repurpose from the EPCR into the violence document. Next, we'll be discussing the intended use by the national, state, and local EMS agencies. The NEMSIS v3 data standard includes 3 data sets currently: the DEM data set, the EMS data set, and the state data set. The hazardous data set supports an EMS agency or state by characterizing the frequency, type, and impact of hazards experienced by the EMS workforce at the agency and state levels, which informs the necessary actions from policymakers and elected officials. It identifies the resources, the training, and the education the clinicians need for preparation, mitigation, and the response to these hazardous incidents. Currently, the HAZDataSet is not collected at the national level. The HAZDataSet violence elements are intended for violence report that can be used to comprehensively and securely document violence experienced by EMS personnel within existing EPCR platforms. So if you're using an existing NEMSIS compliant EPCR platform, you would be able to use the violence report. The HAZDataSet supports an EMS agency or state by characterizing the frequency, type, and impact of these hazards experienced by the EMS workforce. The elements within the HAZDataSet adhere to the national standard, but they stand alone as an optional set of new data elements that the EMS agency or state working with their software vendor can implement. Each software vendor would provide access to the violence against EMS personnel document in its own method. Data elements in the HAZDataSet are optional for use. The state or local agency can include all the data elements or just the data elements that the state or agency would like to use. So we're going to discuss where to access the HAZDataSet in the companion guide. The companion guide will be posted to the NEMSIS website after today's training. So if you wanted to be able to check back for the companion guide, that is a lot of the discussion about today's training. So going to the NEMSIS.org website. So from the home page here, we're going to slide over to our technical resources. Slide down to guides and usages. Once we're on that page, we're just going to scroll down. Go past the dataset guides and you will see the Violence Against EMS Personnel Data Dictionary. If you're in the ability to download that now, I do recommend that. Next, we'll be understanding this HAZDataSet, where we'll actually be going into very fine detail of each one of them. The next here, we'll be doing the understanding of the HAZDataSet. There's a lot of slides here. There's a lot of reading. We tried to break the data elements down very specifically so everyone can understand them. This is also a good opportunity while you're looking at these. If you notice something that needs to be changed, maybe there's a spelling error, anything above, you feel free to submit a help desk ticket to get that completed. Recommendations are provided for the local and state systems to generate and process the elements in the HAZDataSet spreadsheet file. Each section of the HAZDataSet violence document is made up of elements intended to collect different aspects of the violent incident. When you access the spreadsheet, you'll notice that there is columns A through G. Those columns are trying to represent the description of each column is sort of listed here. The new data elements highlighted in blue on the spreadsheet do not correspond to any existing NEMSIS data standard elements or NEMSIS data types. So column A is the element section, the violence against EMS personnel data element number. Column B, the existing element copy. So this is the existing NEMSIS demographic or PCR data element from which data can be copied into the violence against EMS personnel data element. Column C is the element name, which is the violence against EMS personnel data element name. The element definition, the violence against EMS personnel data element definition. Column E is the data type or the field values. So once again, just the field values for these data dictionary. Column F, the NEMSIS data type. So the NEMSIS XSD data type for the violence against EMS personnel data element. And then column G is the recurrence, the violence against EMS personnel recurrence data element. Values are also included for data documentation when an incident of violence against EMS personnel is not associated with an EMS patient encounter. Each element within the HAZDataSet has a recurrent status, which indicates how often the element may appear in the violence document. This next section here, we're going to review first is the HDispatch. This section includes the dispatch information, such as the dispatch reason. This information should be mapped from the EPCR into the violence report if the violent act occurred during an EMS call. So here we'll see our first data element, HDispatch 01. The existing element copy is EDispatch 01. The element name for this is dispatch reason. The definition is the dispatch reason that was reported to the responding unit. Lots of field values for this one. We'll be seeing that on the next slide. The NEMSIS data type is the dispatch reason, and the recurrence is 1-to-1. Next is this list of the field values from HDispatch 01. We've only have 2 slides in here today that actually would require us to list them out this length. Instead of reading them all off, we'll just display them, and they're also available for you within the spreadsheet. You see HDispatch only had 1 data element for it, and we're moving over to the HHistory now. HHistory, this section includes information describing the patient's current condition regarding alcohol or drug use. This information should be mapped from the EPCR into the violence document if the violent act occurred during the EMS call and the patients committed the violent act directed at EMS personnel. Here we can see that the data element for the violence report is HHistory.01. The existing element that we're copying is eHistory 17. The element name is the alcohol and drug use indicators. And the element definition, indicators for potential use of alcohol or drugs by the patient related to the patient's current illness or injury. Same field values that we have for eHistory 17. NEMSIS data type here is alcohol drug use indicators, and the recurrence is 1-to-many. This will be the only data element that will cover the HHistory section of the violence form. So we'll be talking about HPatient. This section includes information about the patient encountered by EMS if the patient committed the violent act directed at EMS personnel. This information includes patient's name, their home address, their age, their sex, and should be mapped from the EPCR into the violence document if the violence incident occurred during an EMS call. And the patient was the individual who committed the act of violence. If a patient's family member, another bystander, or another person who is not the patient committed the act of violence directed at EMS personnel, information about the patient should not be mapped for the violence report. And nobody is asking the EMS personnel or clinicians to obtain any of the information from a bystander or non-patient. First data element here is HPatient 01. Existing element copy is ePatient 01. The element name is the EMS patient ID, and it's the unique ID for the patient within the agency. The data type is a data string. NEMSIS data type is the patient ID, and the recurrence is 0-to-1. Next data element is HPatient 02. Existing element copy is ePatient 02. The element name is the last name. The element definition, the patient's last family name. Data type is the data string. You also have your attributes and not values of not applicable, not recorded, not reporting, refused, and unable to complete. Your NEMSIS data type is the person's last name with a recurrence of 0-to-1. Next data element, HPatient 03. Existing element copy is ePatient.03. Element name is the first name. Element definition is the patient's first given name. It's also a data string. The NEMSIS data type is the person's first name with a recurrence of 0-to-1. Our next data element will be HPatient.04. The existing element copy is ePatient 04. Element name, middle initial or name. The element definition is the patient's middle name, if any. It's a data string. NEMSIS data type is the person's middle name with a recurrence again of 0 to 1. Continuing on, hpatient.05. The existing element copy is epatient05. Element name, patient's home address. Element definition, patient's address of residence. Data string, NEMSIS data type is street address with a recurrence of 0 to 1. There's many data elements within this section because we have to be able to identify where that patient was at. Turning on hpatient.06. Existing element copy is epatient06. The element name is the patient's home city. The element definition, the patient's primary city or township of residence. NEMSIS data type again is the city GNIS code. And the recurrence is 0 to 1. Next data element, hpatient.07. Existing element copy is epatient.07. The element name is patient's home county. The element definition, the patient's home county or parish of residence. The data type is a pattern. NEMSIS data type is the ANSI county code, and the recurrence is 1 to 1. Next data element, hpatient.08. Existing element copy is epatient08. The element name is the patient's home state. Definition is the state, territory, or province where the patient resides. It's also a data string. NEMSIS data type is the ANSI state code with a recurrence of 1 to 1. Next data element, hpatient.09. Existing element copy is epatient09. The element name, patient's home zip code. The definition, the patient's zip code of residence. The NEMSIS data type is zip, and the recurrence here is 1 to 1. Next data element, hpatient.10. Existing element copy is epatient.14. The element name is the race. The definition, the patient's race is defined by OMB, or the U.S. Office of Management and Budget. Your next data element here is hpatient11. The existing element copy is epatient23. The element name is the name suffix. Definition is the patient's name component following family name that may be used to describe a person's position in a family. NEMSIS data type is the person's name suffix, and the recurrence is 0 to 1. Next data element, hpatient.12. Existing element copy is epatient25. The element name is the sex. The element definition, the patient's sex. Data type, female, male, unknown. NEMSIS data type, sex. The recurrence of 1 to 1. Next data element is hpatient.13. The existing element copy is epatient15. The element name is the age. The definition, the patient's age, either calculated from the date of birth or best approximation at the time of the incident. It is an integer. NEMSIS data type is the age with a recurrence of 1 to 1. Data element here is hpatient14. Existing element copy is epatient16. Element name is the age units. Definition, the unit used to define the patient's age. We have days, hours, minutes, months, years. NEMSIS data type is the age units with the recurrence of 1 to 1. And that will complete all of the data elements for the hpatient section. The next section we have here is the hcrew section. This section is not going to be found in the companion document. The reason this section is included in today's training, this section includes information about the crew associated with the unit that was the target of the violent act. So if the information was being mapped from an EPCR, you could actually just use the H or the crew member information to populate. Data element here is H personnel.01. You will see this as a repeat, but the existing element copy, if it's coming from the EPCR, is eCrew01. The element name is the EMS personnel state licensure ID number. The definition is the state licensure or certification ID number for the personnel. The NEMSIS data type is the state licensure ID, the recurrence of 0 to 1. The next data element is hpersonnel.02. If coming from the EPCR, the existing element copy would be ecrew.02. The element name, EMS personnel state EMS certification licensure level. The element definition, the personnel state EMS certification level. For the field values, we do have listed all of the different levels that are recognized. NEMSIS data type is the member level, and the recurrence is 0 to 1. Next section kind of goes along with the crew, but this section includes the name and licensure level of the EMS personnel who were the recipients or targets of the violent act. This information should be mapped from the personnel's record in an agency demographic data or DEM data set into the violence report. So this is just an example where if the EMS was not during a response, and maybe they were just performing some of their non-patient care duties, and they still had an incident. So repeating again for hpersonnel.01, and this will be sort of highlighted here on the spreadsheet for you as well. But the existing element copy is dpersonnel23. The element name, EMS personnel state licensure ID number. The element definition will be the state licensure or certification number for the personnel. NEMSIS data type is the state licensure ID with a recurrence of 0 to 1. Again, here with hpersonnel.02, if you're not active in a response, the existing element copy would be dpersonnel24. Element name, EMS personnel state EMS certification licensure level. The element definition, the personnel state EMS certification level. NEMSIS data type is a member level with a recurrence of 0 to 1. So we have hpersonnel.03. Existing element copy is dpersonnel13. Element name, EMS personnel's race. The personnel's race as defined by OMB, the U.S. Office of Management and Budget. NEMSIS data type is the demographic race with a recurrence of 0 to many. Next data element being hpersonnel.04. Existing element copy will be dpersonnel.40. Element name is EMS personnel sex. Element definition, the personnel sex. Data type or field values is female, male, unknown. NEMSIS data type is sex and recurrence of 0 to 1. Next data element for personnel is hpersonnel.05. Existing element copy is dpersonnel.11. The element name is the EMS personnel's date of birth. Element definition, the personnel's date of birth. It is a date. NEMSIS data type is the date type with a recurrence of 0 to 1. Next data element, hpersonnel.06. Existing element copy is dpersonnel.33. Element name, EMS personnel's hire date. The date the employee was hired by the EMS agency for this current job. That is the data type of date. NEMSIS data type is the data type. And the recurrence is 0 to 1. This data element for hpersonnel is hpersonnel.07. Existing element copy is dpersonnel.36. The element name is the EMS personnel's total length of service in years. Element definition, the personnel's total length of EMS service at any level in years. Data type is an integer. NEMSIS data type is the total service with a recurrence of 0 to 1. The next section will be the H response. This section includes agency and unit response information, such as incident number, response number, the type of service requested, and the EMS, and the response mode to the scene. This information should be mapped from the EPCR into the violence report if the violent actor occurred during an EMS call. First one for the H response, hresponse.01. Existing element copy is eresponse.03. Element name is the incident number. Definition, the incident number assigned by the 911 dispatch system. It is a data string. NEMSIS data type is the EMS incident number with a recurrence of 1 to 1. Next data element is hresponse.02. Existing element copy is eresponse04. Element name is the EMS response number. Definition is the internal EMS response number, which is unique for each EMS vehicle's unit response to an incident within an EMS agency. NEMSIS data type is the EMS response number with a recurrence of 1 to 1. Next data element for response, hresponse.03. Existing element copy is eresponse.05. Element name is the type of service requested. Element definition, the type of service or category of service requested of the EMS agency responding for this specific EMS event. The NEMSIS data type is the EMS service CAT, and the recurrence is 1 to 1. Got a long list of our field values, and those are the exact same ones that we have from our eResponse 05 in the current data dictionary. Next element is hresponse.04. Existing element copy is eresponse23. Element name is response mode to the scene. The definition, the indication whether the response was emergent or non-emergent. An emergent response is an immediate response. There we have our field values. The NEMSIS data type is the EMS response mode with a recurrence of 1 to 1. Next data element, the last one for the response is hresponse.05. Existing element copy is eresponse24. Element name, additional response mode descriptors. The definition of the documentation of response mode techniques used for this EMS response. We have the same list of field values. NEMSIS data type is the EMS additional response mode and a recurrence of 1 to many. Next section here is HScene. This section includes information on the scene where the violent act occurred, including incident location information. The information should be mapped from the EPCR into the violence report if the violent act happened or occurred during an EMS call. We'll have a lot of data elements here to make sure that we're able to capture the scene details. First one being HScene.01. Existing element copy is eScene09. The element name is the incident location type, the element definition, the kind of location where the incident happened, the data string. NEMSIS data type is an incident location type with a recurrence of 1 to 1. Next one, HScene.02. Existing element copy is eScene10. Element name, the incident facility code. Definition, the state, regulatory, or other unique number code associated with the facility if the incident is a healthcare facility. It's a data string. NEMSIS data type is the incident facility code. Recurrence is 0 to 1. Data element, HScene.03. Existing element copy is from eScene.11. The element name is the scene GPS location. Element definition, the GPS coordinates associated with the scene. NEMSIS data type is GPS location with a recurrence of 0 to 1. Next data element, HScene.04. Existing element copy is from eScene12. Element name is the scene U.S. National Grid coordinates. Definition, the U.S. National Grid coordinates for the scene. NEMSIS data type is USNG, and the recurrence is 0 to 1. Data element is HScene.05. Existing element copy is from eScene.13. Element name is the incident facility or location name, the name of the facility, business, building, etc., associated with the scene of the EMS event. NEMSIS data type is incident facility name with a recurrence of 0 to 1. Next data element, HScene.06. Existing element copy is from eScene.14. It is the mile, post, or major roadway. Definition, the mile, post, or major roadway associated with the incident location. NEMSIS data type is mile, post, or major roadway with a recurrence of 0 to 1. HScene.07. Existing element copy is eScene.15. Element name is the incident street address. Definition, the street address where the patient was found. If no patient, the address to which the unit responded. NEMSIS data type is the street address with the recurrence of 0 to 1. Next data element is HScene.08. Existing element copy is eScene.16. Element name is the incident, apartment, suite, or room. The number of the specific apartment, suite, or room where the incident occurred. NEMSIS data type is the scene or apartment, and the recurrence is 0 to 1. HScene.09. Existing element copy is eScene.17. Element name is the incident city. The element definition, the city or township, if applicable, where the patient was found or to which the unit responded, or best approximation. NEMSIS data type is the city GNIS code with a recurrence of 0 to 1. Next data element, HScene.10. Existing element copy is eScene.18. Element name is the incident state. Definition is the state, territory, or province where the patient was found or to which the unit responded, or the best approximation. NEMSIS data type is an ANSI state code with a recurrence of 1 to 1. Next data element here is HScene.11. Existing element copy is from eScene.19. Element name is the incident zip code. The element definition is the zip code of the incident location. NEMSIS data type is zip. And the recurrence is 1 to 1. Next data element, HScene.12. Existing element copy is eScene.20. The element name, scene, cross street, or directions. Element definition, the nearest cross street to the incident address or directions from a recognized landmark or the second street name of an intersection. NEMSIS data type is the scene cross street with a recurrence of 0 to 1. HScene.13. Existing element copy is from eScene.21. Element name is the incident county. Definition, the county or parish where the patient was found or to which the unit responded, or best approximation. NEMSIS data type is an ANSI code. ANSI county code, and the recurrence is 1 to 1. Data element HScene.14. Existing element copy is eScene.22. Element name is the incident country. Element definition, the country of the incident location. NEMSIS data type is the ANSI country code with a recurrence of 0 to 1. And the last one for the scene is HScene.15. Existing element copy is eScene.23. The element name is the incident census tract. Element definition, the census tract in which the incident occurred. NEMSIS data type is census tracts with a recurrence of 0 to 1. Next section is the H situation. This section includes information describing the patient's medical condition at the time of the violent act. Data elements include the symptoms and impression of the patient. This information should be mapped from the EPCR in the violence report if the violent act occurred during an EMS call and the patient committed the violent act directed at EMS personnel. First data element here is HSituation.01. The existing element copy is eSituation09. Element name is the primary symptom. Element definition, the primary sign and symptom presented in the patients or observed by EMS personnel. NEMSIS data type is associated symptoms with a recurrence of 1-to-1. HSituation02. Existing element copy is from eSituation.10. The element name is the other associated symptoms. Definition, the primary sign and symptom present in the patient or observed by EMS personnel. NEMSIS data type is an associated symptoms with a recurrence of 1-to-many. Next one is HSituation.03. Existing element copy is from eSituation.11. The element name is the provider's primary impression. With the definition, the EMS personnel's impression of the patient's primary problem or most significant condition which led to the management given to the patient, including the treatments, the medications, or the procedures. NEMSIS data type is provider's impression with a recurrence of 1-to-1. The last data element for situation is HSituation.04. Existing element copy is eSituation.12. The element name is the provider's secondary impression. Definition is the EMS personnel's impression of the patient's secondary problem or most significant condition which led to the management given to the patient, includes the treatments, the medications, or procedures performed. NEMSIS data type is provider's impression, and the recurrence is 1-to-many. Our next section here is sort of a newer section. Currently within NEMSIS, there is no supervisor section. The H supervisor section includes a follow-up information on the status and condition of the EMS personnel who was the target of a violent act. Supervisors may use the elements in this section to document at 30, 60, and 90 days post-violent incident statuses and conditions of the EMS personnel. The section also allows for the documentation of pre-arrival alerts sent to the dispatch center for future responses if applicable. One of the guiding principles was to promote a process that encourages response, support, and action from our EMS supervisors. Supervisor 01. There is no existing element to copy from. The element name would be a 30-day post-incident. The definition, at 30 days post-incident, did the violence lead to any of the following work-related outcomes for the EMS personnel? Data type or field values was any loss of work time, reassigned to light duty, permanent injury or physical disability, job resignation or dismissal, CISM debrief or diffuse, referral to professional mental health counseling or care, also a section for other, and there's also the unknown at this time or none. Looks like I accidentally put other on there twice, so other would only be there one time. Next section here would be, the next data element would be HSupervisor.02. Once again, no existing element to copy from. Element name here is the 60-day post-incident. At 60 days post-incident, did the violence lead to any of the following work-related outcomes for the EMS personnel? There is no NEMSIS data type to copy. The recurrence is 0-to-many. And once again, other would only be a selection one time. Next data element here is HSupervisor.03. Once again, no existing NEMSIS element to copy from. The element name is a 90-day post-incident. At 90 days post-incident, did the violence lead to any of the following work-related outcomes for the EMS personnel? The NEMSIS data type is none, with a recurrence of 0 to many. Our last data element for the supervisor section is HSupervisor.04. No existing element to copy from. Element name is the creation of a pre-arrival violence risk alert. Definition being, was the recommendation for the creation of a pre-arrival violence alert or standing staging order for this incident location communicated to the emergency call center? Data type is just yes, no. No NEMSIS data type to copy from, with a recurrence of 0 to 1. And this is sort of the section here where the supervisor has that decision to make to call their dispatch center and let them know we need a pre-arrival alert for here or a staging order, so that the EMS personnel who may respond next time can be aware there was possibly a violent incident that happened. The next section here includes the date and time, the information associated with the violent incident. The dates and times recorded can include the dispatch date time, the scene date time, the arrival at the scene, or the destination date time. This information should be mapped from the EPCR into the violence report if the violent act occurred during an EMS call. Section will cover all of the times that are available. First one being just HTimes.01. And we'll try to go through these ones just a little bit quicker, as they are very similar and they copy the exact same numbering pattern as we see currently in ETimes01. All of these have an NEMSIS data type of date time type, and the recurrence will either be 1 to 1 or 0 to 1 as we continue. Second data element is HTimes02, which is the dispatch notified date and time. Recurrence here being 0 to 1. Next data element is HTimes03, the unit that was unit notified by our dispatch date time. Recurrence of 1 to 1. HTimes.04 copies ETimes04, which is the dispatch acknowledged date or time, with a recurrence of 0 to 1. Next data element would be HTimes05, the unit en route date time, copying ETimes.05. This one also has a recurrence of 1 to 1. HTimes.06 copies ETimes06. Unit arrived on scene date and time for the element name. And the recurrence here is 1 to 1. Next data element, HTimes.07. Existing element copy, ETimes07. Element name is the arrived at patient date time. NEMSIS data type is the date time, and the recurrence being 1 to 1. Next data element, HTimes.08. Existing element copies from ETimes08. Element name, the transfer of EMS patient care date and time. Recurrence here is 0 to 1. HTimes09. Element name is the unit left scene date and time. Recurrence of 1 to 1. Next one is HTimes.10. The arrival at the destination landing area or date time. Recurrence is 0 to 1. Next data element, HTimes11. Patient arrived at destination date time. Reoccurrence is 1 to 1. We have HTimes12. The destination patient transfer of care date time with a recurrence of 1:1. H times 13, the time the unit was back in service, date time. Once again, a recurrence here of 1:1. Next element is H times 14. Element name was the unit canceled, date time. Recurrence here is 0:1. Next data element, H times dot 15. Existing element copy is from E times. It's the unit back at the home location, date time. I think I left the recurrence off on this one, but it should be a 0:1. Next one is H times dot 16. EMS call completed, date time. Recurrence here is 0:1. And our last time is H times 17, which is the unit arrived at the staging area, date time, with a recurrence of 0:1. And that will complete all of the times for the E times section, or I'm sorry, for the H times section. And we'll be moving on to our last section, which is the H violence. This violence section includes additional details about the violent incident, such as the time of the violent act, the number of assailants, the physical, emotional, and or mental harms to the EMS personnel. This section's data elements also characterize information regarding who committed the act, the circumstances surrounding the violent act, the phase of the call in which the violent act occurred, and whether law enforcement witnessed or was notified of the violent act. The HAZDataSet provides a format in which the violence against EMS can be collected in a consistent format, which will really help facilitate the improved local and state policies for the trainings. First one, H violence.01. There is no existing copy here. None of the H violence section except for one of them have a existing element to copy from. The element name is the violent incident occurred, date time. This is an additional time that's been added so you can actually document when this occurred. You can also do an approximation with a recurrence of 1:1. H violence.02. This is the number of assailants. Definition being how many assailants were involved in the violent incident against the EMS personnel. There's no NEMSIS data type for this one with a recurrence of 1:1. Next data element, H violence.03. Element name is the EMS personnel is physically harmed. Definition being, was EMS personnel physically harmed as a result of the violent incident? Yes, no, unknown, with a recurrence of 0:1. H violence.04. EMS personnel's emotional or mental health. Did the violent incident impact the EMS personnel's emotional or mental health? Once again, yes, no, unknown, with a recurrence of 0:1. Next one here is H violence.05. This does have an existing element to copy from, which would be E other.06. The element name is the type of work-related injury, death, or suspected exposure. And this is the definition is the type of EMS crew personnel, work-related injury, death, or suspected exposure related to the EMS response. We did cover this data element in more detail earlier. The NEMSIS data type is the type of injury, death, or suspected exposure. The recurrence is 0 to many. Our next slide will focus on the field values for it. We sort of broke them into different categories, but really wanted to sort of focus on this first section here, which was the violence, where we can see that those new field values have been added into version 3.5.1 and are displayed here in this violence form as well. This is, once again, information that could be mapped over from an EPCR into the violence report. H violence 06, who committed the violent act? Element definition is who committed the violent act against the EMS personnel. And this is where we'll be able to say the patient, family member, or friend of the patient, the bystander, other emergency responders, a healthcare facility staff member, and then, of course, other. There's no NEMSIS data type or no NEMSIS data type, and the recurrence is 0 to many. HViolence.07. Existing element to copy from is none. Element name, the circumstances contributed to the violent incident. Did any of the following circumstances contribute to the violent incident? Alcohol, drugs, cognitive impairment, mental health, none. Recurrence here is 0 to many. HViolence.08. The violent act intentional or unintentional? Definition being, in your opinion, was the violent act intentional or unintentional? You have your options of intentional, unintentional, or unknown. Recurrence here is 0 to 1. HViolence.09. EMS personnel's physical injuries. Did the violent incident cause any of the following physical injuries for the EMS personnel? This data element is a recurrence of 0 to many, with our field values of burn, chemical exposure, including mace, drugs, gunshot wounds, blast injuries, head injuries, concussions, infectious exposures of any route, muscles or joint sprain or strain, broken bones, stab, punctures, impalement, smother, suffocation, or strangulation, soft tissue injuries, and then always, of course, a category for other. HViolence.10. EMS personnel's physical injuries or severity. How severe were the physical injuries? Were they minor, moderate, major, or in the worst case scenario, death to the EMS personnel? This one has a reoccurrence of 0 to 1. HViolence.11. This is the phase of the call when the violence occurred. Phases of the call when the violence occurred against the EMS personnel. Was it during the activation or response? Was it during the on-scene time? During the transport? When they actually got to the receiving facility? When they were in service or waiting activation to respond? Or any other type of scenario that they can, other phases that they have. The recurrence here is 0 to many. Few more to go here. The HViolence.12. Element name, was the law enforcement notified? Definition just being, was the law enforcement notified of the violent incident against EMS personnel? Field values here include yes, no, and unknown, with a recurrence of 0 to 1. HViolence.13. Element name is law enforcement witness. Element definition, the law enforcement witnessed the violent incident against EMS personnel. Once again, yes, no, unknown options. NEMSIS data type is yes, no, unknown values, with a recurrence of 0 to 1. HViolence.14. Was a person detained by law enforcement? Was the person who committed the violent incident against EMS personnel detained by law enforcement? Options are including yes, no, unknown. NEMSIS data type is yes, no, unknown values, with a recurrence of 0 to 1. Next element, HViolence.15. The method of violence experienced. What method of violence did the EMS personnel experience? Here we have another large list of property damage or theft, human bites, spit at, peed on, pushed or shoved, kicked, grabbed, choked, struck or punched. Was there weapons involved like ambulance equipment, mace, pepper, chemicals, clubs or a bat, knife or other sharp objects, firearms, explosives, and then always another category if we can't figure all the different methods out. The reoccurrence here is 0 to 1.
Randall,
Next
I
data
hate to
element.
cut in on your time, but we are over time, and I wanted to see if you think you can still get through the last few things here in the next like 2 minutes, or do you think that we can make a supplemental recording or some supplemental information here because there's some people who have to jump off.
Stan, yeah, I can get it done in the next 2 minutes here.
Okay, perfect. Thank you.
Thank you. 8.16, potential risk scene response. Did the dispatch communicate a potential risk for violence prior to the scene arrival? Once again, yes, no, unknown. Reoccurrence here is 0 to 1. HViolence.17, pre-arrival violence risk alert. Do you recommend a pre-arrival violence risk alert or staging Standing staging order to be created for this incident location. Yes, no, and 0 to 1, reoccurrence. Last data element here is hviolence.18. Element name is the violence narrative. It's your ability to describe what happened in your own words with a reoccurrence of 0 to 1. Very quickly here, we're going to run through 2 quick scenarios for everyone just to have an understanding of how the violence report works. If multiple EMS personnel are harmed in a single incident, a separate violence report should be created for each individual as the harm encountered and necessary follow-up may differ. First one is kind of a non-EMS incident violence report. 2 EMS crew members stop at a gas station to use the restroom after clearing a call. As they walk towards the entrance of a uniform, a visibly agitated individual near the doors begins shouting and insults and pacing. When one EMT calmly asks if the person is okay, the individual suddenly steps closer, bumps the EMT's shoulder, and swings an arm in a threatening manner. The crew immediately backs away, creates some distance, and retreats towards the ambulance while calling for law enforcement assistance. They do not engage any further. The individual continues yelling but does not pursue EMS. Once the members reach a safe area, police arrive shortly after. For a violence document, we would have possibly 2 documents here. First one would be EMS personnel who could fill out a violence for the physical attack or attempt to be attacked. For EMS personnel, too, who actually wasn't physically attacked, could fill out a document for offensive, intimidating, or hateful language. One more example here for everyone. An EMS crew responds to a medical call at a private residence. During patient assessment, one crew member moves to retrieve equipment while the other partner continues care. The patient appears intoxicated, makes inappropriate comments towards the other crew member, and attempts to touch them despite being told to stop. Once law enforcement arrives, the patient continues to make inappropriate comments, and law enforcement observes his action. Since the patient still requires medical care, the law enforcement officer will ride with the patient and the EMS personnel to the appropriate facility. That scenario there was just an example of an existing EPCR that would have been completed and being able to map many of those documents right into the violence document. And the last slide today is, once again, any questions about today's training. I do apologize to everyone for going over. There was a lot of material here. Please submit a NEMSIS help desk ticket and someone will be able to answer your questions for you. Also, please visit nemsis.org to obtain the hazardous data set data dictionary. And that is all for me today. Chris, thank you for the extra time.
Awesome. Thank you so much, Randall. I really appreciate your time and effort today and going through all of this with everyone. This video will be available on the NEMSIS website and YouTube channel, so that if you do want to share this with your colleagues and review this information later, please feel free to do so. So thank you so much, Randall. I hope everybody has a great day.